My whole career has been taking on the most complicated cases to try to bring everything we can to help patients most in need.
Despite all of the vision obstacles, Gentry has lived a pretty normal childhood, gone to school, participated in activities and dance.
When I go to dance, I usually just forget everything else that's happening and just focus in on what I'm there for.
Gentry was born with congenital glaucoma. She is visually impaired. You would never know by looking at her grades and the other things that she does that she's having to work so much harder than most people. But I just want her to have a little bit of the burden lifted.
Our office, we see the worst of the worst in this area. In Gentry's particular case, in light of the glaucoma issue, she ended up losing all of her vision in her left eye. In her right eye, she was in jeopardy of the same problem. She then developed a cataract. And she also had a fiber membrane on her lens too, and I just didn't feel like it was in her best interest to have me do the cataract surgery. If I did have a complication, we don't have a retina service in the other room. We don't have an ocular pathology department. And this were my daughter, Moran Eye Center. It was the very first and only place that I thought of sending her.
Gentry, she's a young patient, got a whole life in front of her. And so the importance and the value of trying to preserve her vision is at the highest you can think of. This is her only eye, and this eye's had multiple surgeries. She's had previous trauma to the eye. She had iris abnormalities and zonular abnormalities, and her vision has really deteriorated with both glaucoma and cataract. So she really needed specialized surgical approaches to manage her eye in the condition it was in, and not to put extra pressure on us and the team, but that's what we're in for.
The whole process has just been super seamless. Everything that Gentry's had done in the past, all of that was able to be communicated.
I basically dictated a note summarizing her very complicated history and was very impressed of how easy it was to get something scheduled.
Dr. Ahmed was very respectful to her, even as a teen.
He'll usually sit down and talk to me about what he's actually gonna do instead of saying all the big words that I don't know.
We're not treating just eyes, we're treating people. Seeing concern from her parents, seeing her worries and addressing them and getting an outcome that was positive, that's a very meaningful human experience for me.
When Gentry's surgery was over, he had tears in his eyes when he came to tell me that everything was a success, gave us all hugs. I can tell this is his passion, and he'll do whatever it takes to help save someone's sight.
After the now 2 procedures she's had at Moran Eye Center, each time I felt like she was just coming back from our own post-op care. But it's just not my opinion. You can ask anybody, who would you go to if it was your eye and you had something really, really difficult in the ophthalmology community? You say Ike, everybody knows who you're talking about.
Patients come here with hope. That cannot be established by walls in a building or a machine, right? That's us. And that's why I do what I do. And that's why I'm privileged to be here at the Moran, because we have the ability to do it here. And we want to be available to anybody who needs us.